So Dr. Naylin Appanna, what services do you offer here at the clinic?
Provide a comprehensive gynecological service. We treat all sorts of women problems from abnormal uterine bleeding, period pains, infertility, incontinence, and really even hormonal problems like the menopause, etc. I have a subspecialist interest in endometriosis, so see probably a significant number of people with endometriosis. I also do a lot of laparoscopic surgery, which is keyhole surgery. Very few procedures are done open these days. I probably open the abdomen about twice a year, so a lot of laparoscopic keyhole surgery is probably my subspecialty as well.
So what are the most common issues that you see women for?
Probably abnormal bleeding and pelvic pain. I probably see a disproportionate amount of people with this problem because I've become well known in Hamilton as a person with a special interest in endometriosis, and GP referrals for endometriosis seem to be one of the commonest reasons for me seeing patients.
You're obviously quite passionate about helping women. What are you hoping to achieve?
I want patients to be aware that there are solutions for these women's problems. A lot of women think, I have to put up with this is just my lot in life, and it isn't. I use a lot of education and understanding to make patients aware of what the problem is and help them understand the solutions for it.
How long have you been working in women's health, and what experience do you have?
A long time. That's going to give away my age. I started in women's health after completing my medical degree in 1987. Worked for a few years in Wellington as a senior house officer in gynecology. Then came up to the Waikato. I worked here till 1992. Went over to England for 3 years and came back to Hamilton in 1996. So worked as a specialist since 1996 in Hamilton. Yeah, been doing women's health for about 25 years now.
Do women need to get referrals from their GP, or can they just pop in?
They can call us directly. A number of my patients are referred because they've heard about me from other patients. So patient-to-patient recommendations is probably one of the most frequent way of me getting patients coming in. GP referrals are always better because we get a lot more information that way, but patients can come in directly.
So what is endometriosis?
Well, endometriosis is a condition where the lining of the uterus is found in areas outside the uterus. It's been found as far away as in the brain, and people have presented with things like seizures at the time of their periods. But the commonest area is just in the areas in the pelvis, just outside the uterus. And what happens is every month they get a period, but they bleed internally. The blood's got nowhere to go. It irritates nerve fibers and causes pain.
Should women need to put up with this kind of thing?
Not at all. I mean, the biggest problem is diagnosis. In New Zealand, on average, it takes about 9 years from the time a woman first presents to a GP with period pains and bleeding problems that they get before they get referred to a specialist. We're trying to bring that down, and that's why endometriosis education is becoming so important. People realize they have this. We can help them. We can improve the quality of life quite significantly.
How can we find out more?
You can visit our websites on obgyn.co.nz or endometriosisclinics.com, or you can call us here on 0783 83 400 or 0800 my OBGYN, or you could actually just call in and talk to one of the nurses and get some advice.